Hey, this is Dr. Marc Taczanowski with True Sport Care. The first question that I'm usually asked is what made me get into the profession, and I always relay the story that I was, believe it or not, in the 5th grade. I went to the chiropractor with my mom, who had a car accident at the time. I realized that the gentleman who was performing the treatment on her looked like he was in good shape, looked like he was pretty happy, looked like he was able to provide a pretty nice life for his family. All the patients were leaving the office happier than when they walked in. And I pretty much looked at her and I said, yeah, I think this is pretty much what I want to do. So that's when I decided in the 5th grade that I wanted to become a chiropractor. We're often asked what makes us different, and I never really thought about the answer to that question until we first opened up our practice in 2004. We were traveling around to different businesses, and we were asking, what kind of advice do you have for a new business? And the person asked us at that point, he says, what makes you different? Why should I come to you? And my wife and I looked at each other and we didn't really have a great answer. So we decided to start to do things that were a little bit different. And we just decided to take a sports class. And in that sports class, the instructor for the class actually reported that he was one of the first chiropractors to ever go to an Olympic Games. So I didn't even know that that was a possibility, but when he told us that, I turned to my wife again and I said, I think this is something that I want to do. So I started to take all of the necessary prerequisites in order to be able to be even invited to go to a U.S. Olympic training center and start working with the Olympic squad. I went to Chula Vista, California in 2010, and after I completed my 2-week rotation, you get evaluated. So the staff, the athletes, the coaches, the trainers, they pretty much say, all right, this person is good enough or this person isn't good enough to continue on in the program. And I guess I kept passing all of their requirements because I kept getting invited to come back. And everything wound up culminating in the fact that I was one of the 2 chiropractors selected to travel with the Olympic team in 2014 to Sochi, Russia. So I hold certain distinctions based on my work to try to get to the Olympics, certain credentials, certain techniques, diplomate in sports medicine, chiropractic sports practitioner, certified strength and conditioning specialist. We have a lot of degrees behind us, a lot of letters behind my name. Most of the doctors in the office, we have a lot of these distinctions, and it's because we really care. We really try to help our patients as much as possible. So what kind of pearls of wisdom do I have to offer patients who are seeking treatment? This is a little bit of a loaded question because I don't want to poo-poo anybody else's practice. I don't want to talk bad about any other kind of practitioners, but I kind of feel like there are fewer and fewer people who practice the way that we practice. And everybody that practices in this office is very like-minded. We really try to find the problem, we try to fix it, and we try to get rid of the patients as soon as we can. It's rare to hear this coming from a chiropractor. It's rare to hear this coming from a physical therapist. But we believe that the traditional prescriptions for therapy, 6 times a week for 8 weeks, 3 times a week for 12 weeks, whatever it is, it's overkill. I think that once you find the correct problem source and you teach the patient how to fix that source on their own, then you have amazing results, and you have amazing results quickly. The one thing that we do tell every single patient is that if you expect somebody to do this for you, meaning I'm going to do some soft tissue work to you, I'm going to put you on heat, I'm going to put you on stim, I'm going to do these kind of things to you, and you're not putting any effort into it yourself, you're not going to get fixed, at least not permanently. We teach you, we give you the tools that you need in order to be able to fix yourself, and that actually does work permanently. It's the kind of thing that after, let's say, 6 months, hey, I might be experiencing a little bit of the pain again, you have a nice bank of exercises from which to draw, and you can try those. And you might be able to fix yourself again if the problem arises. But we don't expect patients to come back with the same problem over and over and over again. If that's the case, that means we suck, and we don't suck.